Hey, what's up everybody? So this video is going to be more directed towards people struggling with nitrous oxide abuse and or experiencing nerve damage as a result of that nitrous oxide abuse. And so therefore I wanted to share, reshare. I've talked about it in previous videos, but I kind of want to just reshare since it's been a while since I've talked about my experiences with experiencing nerve damage from heavy nitrous oxide abuse. And my hope is kind of two things. One, to let you know that you're not alone, because I can definitely relate to how scary and horrifying and depressing you losing any abilities of your body, but especially losing, for me in my case, losing the ability to walk or stand. I mean, that's like terrible. I mean, it's terrible. It's so like, wow, I can't even put it into words. I'm sure if, you know, you're watching this and you've gone through or are going through something similar, you can relate to. It's like you can't even put it into words. It's just like so horrible. So, you know, one, kind of just to let you know you're not alone. There's other people other than just me. I mean, from the comments on my other videos I've talked about my story, other people have gone through similar experiences, and likewise people have had some people have had similar experiences physically recovering just as I did. So that's the kind of the second thing too, is to hopefully provide some sort of hope and encouragement to any of you watching this that are experiencing nerve damage to some degree or another. You know, I know it can be as mild as like some, you know, peripheral neuropathy, like pain and numbness in your extremities. You know, not being able to, you know, like having drop foot, not being able to like move your toes, all the way up to needing to be in a wheelchair or, you know, use some sort of assistive device. So before I kind of briefly recap and share my story, I just want to say two things. One, this is not medical advice. I'm not a medical professional. I used to be a nurse. I'm not an active nurse, and even if I was a nurse, I'm not a doctor. So this is not medical advice. And then secondly, everyone has their own unique body and biochemistry and unique experiences. So, you know, I can't say, I guess, unfortunately, I can't 100% say like, yeah, you're going to be able to pretty much completely recover as I did. But I want to just let you know that it is possible. You know, in my experience, it was possible. And even though I'm, you know, honestly, to this day, I'm still surprised that not only was I able to recover to pretty much 99% normal, but the fact that I am not dead, and the fact that I'm not like cognitively impaired. I mean, I'm sure there's, you know, some dysfunction in my cognitive abilities than, you know, before. But, you know, I feel like I'm still relatively intact, so I'm very thankful for that. I'm very grateful. But yeah, I just abused so much that, like, again, I'm just surprised, like, you know, for all of that, you know, I just don't know how I was able to recover. So, you know, hopefully, my thought process is if I was able to, you know, hopefully most other people are able to. But again, my recommendation, I guess, one last thing before I kind of start, my recommendation is to get medical help, and then, you know, kind of just follow their recommendations. Usually a lot of doctors will prescribe intramuscular B12 because it's a better absorbed version of B12. For those of you that aren't aware of kind of the mechanics behind the nerve damage, nitrous oxide depletes vitamin B12 in the body, so heavy sustained use puts the body in a very precarious spot. B12 is involved in the maintenance, well, it's involved in a lot of things, but it's involved in the maintenance of the nerve fibers, particularly the myelin sheath, the insulation around the nerve fiber. So when there's no B12, that metabolic, those processes that maintain that insulation aren't able to occur, and then so the insulation kind of gets damaged, and then that's where the nerve damage happens because the nerve isn't able to fire effectively. So a lot of doctors will prescribe B12. Other people just recommend, like, you know, if let's say you don't want to go to a doctor or can't, you know, at least take oral B12 supplementation to kind of build back your levels. But what I'm trying to get at is just follow their advice, seek help, follow their advice. This is not, you know, I'm not trying to give anyone like advice on what to do. I'm just simply sharing my experiences, and hopefully you can know that it is possible. You know, 100% guaranteed, I can't say that, but you know, I think the human body is amazingly resilient and adaptable. So I think it's possible for a lot of people. Yeah, like I said, for me, like I was abusing, like, during my peak, like, well, I don't even want to get into it because it doesn't really matter, but I was abusing a whole bunch of nitrous oxide. I've spent, I had to file for bankruptcy. Like, I would guess maybe I spent like $40,000 to $60,000 in like a 3.5 month span. So I'll leave it at that. Quite a large amount. So what happened with me is I had a pretty quick onset of nerve damage. After traveling to and from my parents' house because they were worried about me, the morning after I got back home is where I woke up and I wasn't able to walk or stand. I had to like literally like crawl around my apartment to get around. Because I just had no coordination and no strength to, you know, like get out of bed and just stand. Like I mentioned earlier in the video, like I had complete drop foot. My foot was totally floppy and useless. Even if I wanted to, I could not move my toes even a millimeter. Like I could sit there and focus and I couldn't move them. But as you can see, I, you know, have full control. Mostly full control. That's why I say I'm 99% normal. Like there's still some numbness, a little bit of numbness in my toes, but so yeah, I had a very quick onset and it was pretty dramatic. I wasn't able to walk or stand for several weeks, and because I wasn't able to go to the store anymore, I was pretty much forced to abstain from nitrous oxide, which thank God, because I still wanted to use it. You know, I was still wrapped in that mania and psychosis, that just crazy headspace, and especially not being able to walk. That's incredibly depressing, like I said. And so it's like if I could have, I would have continued to use more nitrous oxide, and who knows what sort of effect that would have had to me on me to this day. So that's another thing too, is like if you're experiencing nerve damage, as your doctor will probably tell you, stop using nitrous oxide. I know that's a lot easier said than done. You know, it certainly was for me. I understand the addictiveness of nitrous oxide, especially again when you're feeling that like mania and psychosis from such heavy use, and like you're just wrapped into this like fantasy, like the delusions of grandeur. It's just so hard to like break out of that. So that also, you know, maybe seek professional help in terms of maybe going to inpatient or rehab, doing an intensive outpatient program, something of the sort. There's, you know, you shouldn't be ashamed to ask for help and get help. you know, but I know, again, I know that's easier said than done. So, but I just kind of just want to throw in my suggestions, and it's not medical advice, just suggestions. So because I was forced to stop essentially because I couldn't go to the store, after that few weeks of not being able to walk or stand, I was able to regain a tiny bit of strength and coordination. And I could start to stand if I had, like, you know, crawled over to, like, let's say a chair, and, you know, I put my hands on the chair and, you know, hoisted myself up. But if I were to let go, I would fall over, or, you know, tip over, because I just didn't have enough strength and coordination and enough balance. My feet were still pretty much cooked spaghetti, and they're just noodles. Same with my legs, just so I was able to at least stand if I had some assistance. And then you know, that I persisted for a few more weeks, and then I was able to eventually start getting to my feet on my own. But I could only stand for a very brief period of time. My feet would kill me, and I just, because I think I lacked muscle tone and coordination. So it's like I would be on my feet, but like it would just be like not how it's supposed to be, you know, like, you know, functioning human body, like a functioning nervous system. So I was only able to stand for very, very brief periods of time at first, and I could walk very slightly, but it was incredibly wobbly. Like my gait was just very, like, well, I guess you can't really see it, but it was really bad. And because of that, I still was not able to leave my apartment. So I was a recluse for quite a long time because I just couldn't leave the apartment, and I really had no one to, you know, help me. So fortunately I was able to, like, I had enough food to, like, get by. But, you know, it just, while continuing to abstain from nitrous oxide, and slowly walk a little bit more per day, I slowly regained more and more function and more feeling in my extremities. I didn't mention it, but I also, when the nerve damage first onset, I had very weak grip strength. Like I couldn't even, like, open like a bag of chips because I just didn't have that function and nervous system to, like, engage all my muscles. But fortunately, that kind of improved relatively quickly. It was my lower extremities, my legs and my feet and toes, that took quite a long time to recover. I think what helped me the most, well, I guess before I get into that, so, you know, I was slowly recovering, but my friend finally kind of, like, persuaded me to go to the emergency department, and I was really hesitant because I'm just like, there's nothing that they can do. Like, they can't prescribe me anything that's gonna, like, regain nerve function. Like, I thought, and this is why I was part of the reason why I was so depressed. Well, yeah, part of the, like, negative feeling, like depression, but again, just terrifying, because my understanding was any damage to the nervous system, you don't regain that. Like, if you damage your nervous system, you're just screwed. But I think with the way that the nitrous oxide abuse affects your nerves, the nerve damage, I think it seemed, this is like bro science, so I can't say for sure, but my guess is that once you abstain from nitrous oxide and your B12 kind of comes back a little bit, especially if you're eating food that has B12 or supplementing, that nerve fiber is still intact and just has, like, worn myelin sheath, so maybe it's able to, like, repair it. So it's like you're not like having a nerve fiber like severed or like cut. It's just not functioning properly, but you know, provided you give it the right situation, it can recover. That's my guess. So, but I didn't really like know that at the time. At the time, I was just like, okay, I'm never gonna walk again. I'm never gonna be able to, or like, you know, be normal again. So I'm like, why go? Like there's no point. And really, there wasn't any point. I went, and then they gave me like a liter, an IV of normal saline, and then prescribed me vitamin B12. They drew some labs. My B12 was fine at the time, but there was another lab that they drew was methylmalonic acid, and it's a metabolite in part of the process like that it can indicate vitamin B12 deficiency. So even though like my B12 was still fine at the time, my body had like a huge buildup of metabolic waste. So I guess it was nice to like get that confirmed, but I knew like what was going on, like, and I was aware of the risks. Like when I started nitrous oxide or started abusing nitrous oxide, I was aware of the risks of vitamin B12 depletion. I just didn't care, you know, because I was just going through a really tough time, but that's not important. And then, yeah, so they sent me home from the ER with a prescription of B12, which I never filled. Primarily just because getting around was just so difficult still. But yeah, I went home. You know, they wanted me to go get imaging. I never followed up with that. I'm sure if I had, they probably would have had me work with like physical therapy, and maybe prescribe me some like gabapentin or something for like, you know, like some numbness and pain. But short of that, I mean, not much else. But I think what helped for me was just continuing to walk a little bit more and more and more, and like stand for longer periods of time, every day, or as consistently like as I could. And this is going to sound terrible. I do not advise you to drink. I'm sure that's not good for your body, but for me, because I was like mostly out of money and couldn't afford any more nitrous, and like also there's nowhere I can like really walk to, at least not that far yet. I turned to alcohol to help kind of cope with the devastation and the loss and like just the chaos. I just blew my whole life up in a matter of like 4 months. So I turned to drinking to kind of maladaptively cope. And so I think what helped me was not to drinking, but walking to the corner store and back every day to get alcohol. I think that's by walking, you know, kind of just, well, it just like, I don't know. I think it was helpful in, recovering my ability to walk. But it was a very slow process, from the very onset to like getting to like 99% normal. I'd say it took me about 18 months, so like a year and a half. And fortunately I had, an old coworker who really supported me, like early, like, or late-ish 2020. And she helped so much. We're no longer friends. But she kind of encouraged me to like walk, like we go out to trails and like hike and stuff like that. Not like hardcore hiking, but like at least, you know, walking more. And I think that just continued to help. But I never took B12. I never took any sort of supplements. I know there's some that they recommend. I don't know specifically what ones. I know B12, one of them, of course. But I never took B12, never took any supplements. I just started eating again, and it wasn't even like a clean diet. It's just kind of the crap I eat now. But of course, B12, I mean, you know, like meat products and stuff like that. So I was able to get some. And at the end of the day, it's still some nutrition, still some building blocks. And like I said, never did like physical therapy, never followed up with a doctor and got prescribed any medications. I was drinking. I was drinking daily, and despite all of that, I was able to recover to 99% normal after that 18 months. So this was the nerve damage happened March of 2020. So it's been quite a while since all of this has happened. But ever since, the 18-month mark, I can, well, my fitness was still very low, but I started to like go to the gym and like work out again and eventually become more and more fit. So I'm still like, my cardiovascular is not that great, which is why I'm trying to bike more. But I can still, or was able to like, walk relatively normally and relatively stably. And if I didn't mention it, my gait became more and more stable as I continued to walk as time went on. But now it's pretty much normal. If I overexert myself, sometimes I get a little wobbly. So that's why I like to say like I'm 99% normal. Definitely not at the very same level as I was prior to all of this happening. But I can walk, stand, I can jog for short periods of time. I can run for very short periods of time. I can bike ride, I can jump, I can go to the gym and do a leg workout. And I do most of those things. Well, not so much the running and the jogging or jumping, but what I'm trying to say though is like I'm able to function. Like I was able to regain most of my physical, I was able to mostly physically recover. And I've been able to stay away from nitrous oxide for over 3 years, as well as everything else, alcohol, kratom, what else was I, well, just whatever I can get my hands on. Like I'd abuse anything, but I've been in recovery for over 3 years, and I'm living a pretty good life. I work as a recovery coach part-time, which I enjoy. I'm getting more and more fit. My life is just really good. I'm very grateful. So all of this to say is I think for a lot of people it is possible, maybe not a complete recovery, but I do think that, like I said, the body's amazing. It's, able to adapt, and it's very resilient. So, I think for a lot of people it is possible. And then especially if you do follow the advice of your doctor, that might, like my recovery might have been sped up if I, wasn't drinking and like I took B12 and like worked with physical therapy to help me adapt. Even without doing all that, I was able to eventually recover. So my hope is that most everyone that abstains from nitrous oxide and follows their doctor's treatment will be able to recover just as I did. And then, besides the physical recovery, it's that psychological recovery. My suggestion, again, seek treatment, inpatient or outpatient. Find groups to go to, there's a really great, I think it's called No to N2O, which is nitrous oxide, No to Nitrous Oxide group. There's also a quitting, I think there's a quitting nitrous or like nitrous harm reduction subreddit, and then they also did a nitrous recovery subreddit, and you can look there for links to the meetings. Like I think they meet like 4 times a week now, so it's cool because there's like a specific meeting for people struggling with nitrous oxide addiction. But AA, NA, Smart Recovery especially, I think you can go to a lot of different meetings, and you might not be able to relate so much with other people, like alcoholics or people with addiction to other substances. But I think like with the 12 steps, I don't personally practice them formally, but you know, to become successful in my recovery, I've kind of informally done those things. But I think those steps apply to anyone in any situation. Like, it's not so much, AA and NA is not so much like what drug or substance you abuse, it's recovering from that abuse. So I would recommend that. You know, try to get supportive friends and family, especially to help hold you accountable. That's going to be incredibly important. And, you know, consider, if you're still struggling despite all of that, strongly considering moving into sober living for a few years. You know, I've been living in sober living for the same amount of time I've been in recovery. I owe a lot of my recovery to the sober living house. So definitely takes some getting used to, and you'll most likely start off in a shared bedroom, which can be kind of weird, but you get used to it. But it can be a really supportive environment to, you know, help you with your recovery. And usually rent is pretty affordable too, so that's a bonus. But yeah, that's kind of about it. I just wanted to make a video because, like I said, it's been a while since I've talked about this stuff, and I know there's other people out there struggling. So yeah, just know that you're not alone. There is support out there one way or another, and you know, I was able to recover almost completely. So it is possible, is I guess my message, and hopefully that provides some hope to those of you struggling with the nerve damage, or, you know, I guess even more broadly, like anyone struggling with any sort of addiction and trying to achieve recovery. It is possible. It's incredibly difficult, but it's definitely possible. So yeah, I just wanted to share all that. If anyone has any questions for me about my experience with nitrous oxide and the nerve damage, or just any questions with any of my life story, like with addiction and recovery, please comment. Please drop a comment. Let me know. Like, throw down a question. If you have anything you'd like to contribute, please comment. You know, maybe you have something that I didn't touch upon that might be helpful to someone trying to achieve recovery. If you like the video, please let me know. Like, because of everyone's feedback, I'm kind of getting a better idea of like what people want to watch, or like what does well, and I want to try to provide the best content as I can. So yeah, please comment. I read everyone's comments. I try to respond to everyone's comments. I really appreciate everyone's comments. Additionally, I just appreciate everyone's viewership. It really means a lot to me, and it means a lot to, if you feel so inclined, to hit the like button. That helps us grow this channel so we can reach more people with videos like this, and consider subscribing or following. That also helps grow this channel, and hopefully we can grow this to become a bigger channel and reach more people. And I can continue to make videos like this, as well as like silly videos like the mukbang videos. So yeah, that's all I have to say. I appreciate every single one of you. Thank you. I'll see you guys next time.